Thank you, Jill. This will be a really brief financial presentation because we've got time constraints. I'm more than happy, if anyone wants to get in touch with the district office and we can go through this in more detail. But we're just going to give a really a high-level snapshot of the health service's financial position. The district has an agreement with New South Wales Health each year to provide a level of service, and Jill will have told you we did extra activity in emergency departments, we did extra surgical activity. That creates a range of pressures on us about managing our finances. And so what we have with our position as different to a lot of commercial organisations, our performance is assessed on our performance to our budget. It's not just whether we make our profit, because we're showing there that we had a net income result of $44 million. That includes a lot of capital revenue that goes to capital projects which are not shown in the operating statement. And what this shows you at the top line is on our expense side, we were $7.8 million unfavourable to budget. On the next line, on our revenue side, we were $2.6 million favourable. We have some other losses which are about how we rate our debtors and what have you. But the fundamental is our net result is we were $4.4 million favourable. The summary of that is we're really quite good at managing our revenue. We're not quite so good at managing our expenditures. And if I could go through the next slides, I'll just highlight a couple of those for you. This is about the inputs of our organisation, where we spend the money. So that's what we're actually to drive the services we provide. And what that shows you is that 56% of our expenditure goes in employee-related costs, 8% on VMOs and 30% in goods and services. It's interesting to note, compared to previous years, our employee-related percentages have decreased slightly. But so that's the inputs that we have, but you can see that VMOs, whilst they're external contractors, about that people involved in delivering our services, we've got in the middle of about 65%, 64% of our expenditure goes in providing. So we are a very people-dependent organisation to deliver services. So this is the part that's actually the community probably wants to know more about. So now we've had that expenditure, we spent $500 million on it. What are the services that we provide? And Jill's spoken about specifically about EDs and what have you. And there's 43% of our expenditure through all of those other sources goes on inpatient services, so they're within hospitals. We've got 15% is in emergency department and 7%. So there's a significant amount of this money is still around our hospital-based services. What is probably interesting, we're going to have a bit of a talk about, and there might be some comment a bit later, that we spend 8% of our expenditures go on mental health. And Jill also mentioned about Aboriginal health. We're spending 1% of our expenditure on Aboriginal health. That's actually, in addition, the Aboriginal community also receives services through our inpatient. That 1% is about specific Aboriginal focused programs. I'm sure there'll be debate in coming days and months and years about the splitting of that, and I think some of the stuff that Jill was talking about, our strategic plan, will talk about how we realign these services to actually better fit the needs of the community. So they're just the facts that are out of it, so I'm not making a judgment on what the future will hold for them. So just moving on to highlight some of our expense issues, and what you can see there is over the last 3 years, our employee-related expenses have gone up 13%, our VMOs have gone up 19%. So they're the predominant people that actually provide the services. There's been some shift between people that were previously employed as medical doctors in the employee-related area. They are our staff. They've moved to the VMOs. There's also been some increased costs in the recent years as we've actually we've brought back an acceptable or a desirable level of service at places such as Hay, where Jill was talking about. Our other expenditures are substantially goods and services. We've actually reduced those marginally. So that's actually a good thing, but it just shows that when you look at those numbers, you can see that managing our expenditure and managing our services it's about managing our employee-related and VMOs, our goods and services, those services we purchase in or we're required to purchase in, we're broadly managing those. On the revenue side, we have some at the bottom of the table there you can see the government revenues, government allocations over the 3 years, it's actually a 2-year increase. We've gone up 6.5%. So we're actually getting a revenue funding to us that's greater than the general CPI. But also I've tried to highlight some of the sources of revenue that we have more control ourselves to manage. And our inpatient fees, that's private health insurance, and we are one of the best in the state at getting the community and getting patients to use their private health insurance. That's increased by 17%. Some of that will be about increases in the rates, but certainly to have grown that level of revenue is significant. Our nursing home fees, they've remained reasonably static and in real terms have decreased marginally. Our Department of Veterans Affairs income, there was a spike in 2013 for some accounting issues, but fundamentally that is a source of revenue that's decreasing. We do our best to identify these people coming in, we do our best to provide them with good service, but as a funding stream it highlights the pressures coming onto us about how we will manage our people in our facilities. Clinical services are to other organisations. Motor Accident Authority revenues have increased noticeably, and that's partly to do with the different funding formula that's come in, so it's moved on to a more of a case-weighted basis. And our multi-purpose services, these are these new facilities, the Lockharts and what have you. What's happened there is we've actually grown our revenues there. That is substantially, that increase is to do with Lockhart. It is also the multi-purpose service revenue is actually a Commonwealth contribution, and it replaces state contributions. So that's just there for your information. So the challenges we've got, as I think I've spent the last 3 years I've been giving this report, they're pretty well the same issues that we have. It's actually providing services within the allocated budget. That's what the ministry has, that's what New South Wales provides us with. It's absolutely critical at a state level that health services manages within their budget. We also have and you saw the first chart about where we spend the money. We certainly have to understand our costs, and there's been a lot of work happening in the last 2 to 3 years around activity-based funding. People think that's about a funding cut. It's not actually about funding cuts, it's about understanding our costs so that if we know where people are receiving their care, whether it's in the ED, the theatre or a ward or in rehab, if we understand those costs, we can then benchmark and see, is this the most appropriate way of providing that service? So whilst we're focused on dollars, it's about the dollars that provide the service. And what we can do is if we improve that costing, we're in a much better position to make decisions about where we want that money to be spent. If you go back to that first chart where we spend 8% on mental health, if we get those costs and we understand them, we can determine is that what we really spend, and is that what we really need to spend. I'll have words with you later, Sarah. The summary. So the situation is that our overall position, our financial position, is unsatisfactory. That's recognised by the ministry. It's recognised by the board. We've actually entered into arrangements with the board and through to the ministry where they have a plan in progress to actually improve the financial position. And fundamentally, whilst there's a lot of challenges in doing that, it is currently on track. There will be issues again next year, and there will be issues again the year after that as our environment changes, as our population and demographics change. So, very quick snapshot. That's our financial position. I'm more than happy to take questions if Sarah will let them. But we may, after the meeting, but certainly if you can contact me or contact the district office, I'm happy to be involved in any discussions. Thank you.